Good afternoon, everyone. This is Dr. Moreau with Kozile Call. As always, every Sunday at 3 p.m., I'm live to bring you information, and we believe that the more informed you are, you'll be able to make better decision for you, your friends, and family members. So as always, I'm gonna go ahead and do my invite, and then I will proceed with today's presentation. So I hope that you guys are taking advantage of these presentations on Kozile Call, and that you don't keep that information for yourselves. You share that information with everybody else that you know, because they also can benefit. So I'm inviting a few more people, and then I will go ahead and proceed with today's presentation. All right, so once again, good afternoon. It's always a pleasure to be here with you on a great Sunday afternoon to bring you information. Then again, do not keep that information for yourselves. Please share with everyone else, so that way they can also benefit. So last week, for the past few weeks, we spoke about antisocial personality disorder, avoidant personality disorder, borderline dependent personality disorder. So today we're going to touch on histrionic personality disorder. So histrionic personality disorder. So we're going to call that HPD. So when you hear us say HPD, we are talking about histrionic personality disorder. But before we begin, as you know, we have an election coming up in about a few days, more than 2 weeks. So in about 14 to 15 days, we have this election coming up. So we are encouraging everyone to become aware of what's going on, and for you to vote. Encourage those who can vote to vote. As you know, there are people who can vote. Sometimes they sit out and they do not vote, so they do not understand the importance of the voting power. So when you can vote, you need to vote, because your vote can help, or will help make a difference. So you need to vote. So today, I'm going to share with you a few amendments that are being considered in Florida. And for those of us who live in Florida, these are the amendments that you will be voting for, and for you to be mindful of them. The first one is partisan school board election. So they're asking for whether or not the school board members should vote on partisanship, whether they are Democrat or Republican, because right now the partisan the school board are non-partisan, but they are asking whether or not they should be partisan. So the right to fish and hunt. So should we have the right to fish and hunt? The third amendment is legalizing recreational marijuana. Should we legalize marijuana as to be recreational? So that means anywhere, everywhere you go, people could have it on themselves. People could have it in their backpack. You could maybe take at work, take a 30 minutes lunch break, and you go to your car, and then you smoke a joint. So they are asking whether or not marijuana can be recreational. So Amendment 4, legalizing abortion until birth. So legalizing abortion until birth. So should we legalize abortion until birth, meaning somebody could be 7 months, 8 months, 9 months pregnant, And if abortion is legal, so that means you could have somebody 7 months or 8 months pregnant going to have an abortion. So um, those are amendments you should be reading more about, because you only have 2 weeks, because early voting actually begins tomorrow in Florida. So you can begin voting tomorrow in Florida. So you need to become aware of these amendments and how they can change your life or our lives. Homestead exemption tied to inflation. Homestead exemption tied to inflation. You need to read more about that to know what that means. And then the last one is the repeal of taxpayer funding for political campaigns. The repeal of taxpayer funding for political campaign. Are you for or against that? So you need to read more on these 6 amendments, so that way you can figure out how to vote. So when you go into that voting booth, so you can go ahead and you know, and vote according to what you've read and your conscience, right? So once you vote, you cannot change your vote. So your vote is one time. So again, early voting begins tomorrow. You can vote, and you need to become aware of the amendments. You need to become aware of what our senators Rick Scott and what's the lady name, the Democratic Marcus Powell, right? Marcus Powell, she's the Democratic candidate for the Democrat for U.S. Senate, and Rick Scott. So you need to know what do they stand for, right? Compare what do they stand for, what do they support, and what do they oppose. Are you for or against those things? And it's the same for Kamala and Trump. So what do they support and what do they oppose? So, and then you can vote based on that. So I'm not gonna ask anyone. I'm not gonna tell you how to vote. You're going to vote your conscience, and November 4th, November 5th, on Tuesday, we will have an election, a general election, and then we will have a president. So once again, for the next 3 Sundays, I will go back and touch more and talk a little bit more about the election as we are approaching November 5th. Today, we're going to talk about histrionic personality disorder. So what is that? What is histrionic personality disorder? Again, I'm going to refer to that as HPD. So well, I'm going to give you an overview. So this personality disorder is marked by unstable emotions, distorted self-image, and overwhelming desire to be noticed, right? People with this type of disorder, they also behave dramatically or inappropriately to get attention. So these people with HPD, they behave dramatically or inappropriately, so that way they can get attention. So the self-esteem depends on the approval of others, right? They don't realize their behavior and way of thinking may be problematic, and really only 1% of people have that type of condition. So as I'm going to the symptoms, you can think about your friends, your family, people you know at work, your colleagues, co-workers, to see if any of those people have that type of condition. So what are the signs and symptoms of histrionic personality disorder, HPD? So they display excessive, superficial, emotional, and sexuality to draw attention to themselves, right? They may feel underappreciated or depressed when they are not the center of attention. They may have rapidly shifting and shallow emotions. They're so dramatic that they can embarrass friends and family in public. They have a larger than life presence. They may be persistently charming and flirtatious. They may be overly concerned with their physical appearance. They may use their physical appearance to draw attention to themselves by wearing bright colored clothing or revealing clothing. They may act inappropriately sexual with most of the people they meet, even when they're not sexually attracted to these people. They speak dramatically and express strong opinions, but with few facts or details to support their opinions. They may be gullible and easily influenced by others, especially by the people they admire. They think that their relationships with others are closer than they usually are. They have difficulty maintaining relationships. They often are seemingly fake or shallow in their interactions with others. They need instant gratification and become bored or frustrated very easily. They constantly seek reassurance or approval. So they crave and seek attention. They are perceived by others to be vain, self-centered, or insincere. They have an extroverted, dramatic style that people find charming. So people find charming their extroverted or dramatic style. So these are the different signs and symptoms of people with histrionic personality disorder. What are the causes? What could cause someone to have that type of disorder? So it could be genetics. It tends to run in the family. It could be because of a childhood trauma or because of child abuse. It could be because of your parenting styles. A style that lacks boundaries, overindulgent or inconsistent may cause HPD. In addition, parents who display dramatic, erratic, volatile, or inappropriate sexual behavior put their children at risk of having HPD. How do you get a diagnosis? How do you diagnose somebody with HPD? So people with HPD usually seek help because of anxiety or depression due to the problems created like divorce or lost relationships because of HPD. So they seek treatment because of the problem associated with HPD, not because of HPD. So they seek treatment because of the anxiety or depression. If they feel uncomfortable when not the center of attention, they are also seductive or provocative behavior. They show shifting or shallow emotions. They use appearance to draw attention. They are impressionistic and vague speech. They have dramatic or exaggerated emotions. They are easily influenced by others. They consider relationship more intimate than they are. So when somebody have one or more of these persistent behaviors, so if you have these behaviors as just mentioned, if they are persistent, either one or more of them, then you can be diagnosed with HPD, right? People shifting or shallow emotions. They use appearance to draw attention. They have an impressionistic or vague speech. They are dramatic or exaggerated. They are easily influenced by others. They are uncomfortable when they're not the center of attention. So all of these, if you have one or more, you can be diagnosed with HPD. So are there any treatment for people with histrionic personality disorder? So people with HPD tend to exaggerate their feelings and dislike routine. There are many different types of therapy that can be used to treat people with HPD. You could use functional analytic psychotherapy, cognitive analytic therapy, cognitive behavioral therapy. You can use talk therapy, which is group therapy. Talk therapy is psychotherapy. You can use group therapy as well, supportive psychotherapy. So all of those different types of therapy will depend on your symptoms. When you go see a psychiatrist, a therapist, or a psychologist, once they do an intake and they do an assessment, that's called biopsychosocial assessment. So based on that, that's what you will determine which treatment they will use to help you with HPD. So they can use either one of those types of therapy. So clients who engage in treatment can improve their functioning in work and interpersonal relationships. So when you seek treatment, you can improve your functioning at work and in interpersonal relationships. So treatment will be beneficial to you. The only thing is, people with HPD, they tend not to acknowledge the disorder. So they say, I'm fine, I'm fine, I'm fine. So again, they seek treatment because of their anxiety or depression, not because of the HPD. But when you do seek treatment, it will help you function better at work and in your interpersonal relationships. So if you know people dealing with HPD, people who may have those symptoms that I mentioned earlier, right? So if they have some of these symptoms, I'm not going to go over all of them. They may be persistently charming or flirtatious. They have a larger than life presence. They are so dramatic that they can embarrass friends and family in public. They act inappropriately, sexual with most of the people they meet, even if they're not sexually attracted to these people, right? They speak dramatically and express strong opinions, but with few facts or details to back up their opinions. So all of these signs, all of these symptoms are people who may be dealing with HPD. So if you know anyone with those signs, with those symptoms, encourage them to seek treatment, because treatment will help them function better at work and in their interpersonal relationships. So this is all I had for you for histrionic personality disorder. We will continue with the other disorders next week, and we will talk more about the election as well. So this was Dr. Moreau for Causer l'École. I wish everyone a great Sunday afternoon and a great week. Be blessed. I will see you next Sunday.